We welcome you all to Talk the Talk. My name is Janine Steen.
And I'm Toni-Ann Antoniato.
A Masters of Myofunctional Therapy, interview physicians and dentists on Long Island so you can learn how their services can benefit your child's speech and language development and complement the therapy that they are receiving. Hi, today we are here with Dr. Michael Campo, owner and operator of South Shore Chiropractic with locations in Farmingville and Shirley. Welcome to our Talk to Talk today. We're so glad to have you speaking with us.
Thank you so much for having me. It's an absolute honor and pleasure to be here today. I appreciate the invite.
Oh, we love it. Thank you. The more information we can get to the listeners and the observers is always beneficial. Education is always key. So you are going to be a benefit to so many when we appreciate that. So I'm going to speak to you a little bit about some of the questions we often hear, some of the questions that we often have regarding referring to chiropractic and how that can support some of our patients, specifically with the pediatric population. So how would you say a chiropractor can support that pediatric population?
Well, it's chiropractors fit into the puzzle piece in regards to the collaborative workup of patients. Being a practitioner for 24 years, my youngest patient was 2 weeks old and my oldest patient was 98 years old. So,
Okay.
And everybody is treated individually. When you're dealing with the pediatric population, they are their own special breed. The wonderful thing about kids is they do respond quickly to care. They heal a lot faster than myself and as well as you guys.
And us, yeah.
But I get a lot of referrals from pediatricians as well as oral surgeons in regards to dealing with pediatric issues.
Okay, great. I know that we have a lot of children that we see that will have ear infections and allergies, asthma. How as a chiropractor can you support these children?
A chiropractor, we are neuromusculoskeletal specialists dealing with disorders associated with spine and peripheral extremities. We deal with the obvious in regards to neck pain, back pain, pinched nerves, disc injuries, sciaticas, but we also deal with more systemic type issues as well. In regards to children, we've dealt with continual congestion of fluid in the ears. We've dealt with attention deficit disorders. We've dealt with asthma. Understanding that the nervous system, the nerves control every cell, tissue, and organ in your body. So coming to the cause or the understanding of why somebody is suffering something is also helping the treatment of. So when a child, for example, for ear infections, that's a common one for kids. It's almost in vogue that it's almost a reflex now for putting tubes in their ears to allow for this drainage. When you're a child and especially an infant, your eustachian tube is very straight. And as we develop and get older, our eustachian tubes become more tortuous, allowing for drainage. So if it's very straight, think about a 98.6 bath and then what happens is you have the congestion that eventually leads to infections. They're thrown on antibiotics and they go through a realm, and parents come to me sometimes because of the spectrum of doing nothing to the spectrum of doing surgery. They want to avoid that. In your realm, being underwater, it affects both pronunciation, learning. These are all the things that we want to avoid for children. As a chiropractor, the different reasons that can occur is either you can have allergies, and the allergies with histamine, you can have congestion. Sometimes the teething creates congestion back into their ears. And on cervical adjustments, they help in allowing the fluid to drain. And that's, in regards to, ear infections. There are other kind of causes, and the whole idea is to avoid surgery. Sometimes that's inevitable, but many times if you can support that drainage as they continue to develop, and if it could be avoided, that's terrific.
Is a chiropractor acting proactively or reactively when you have a patient that is either suffering from ear infections or chronic fluid? Is it normally that diagnosis is made, say, by a pediatrician, and then they see the chiropractor? Or being that everyone's eustachian tube is straight at that time, you should be doing it proactively in order to limit the chances for fluid developing?
Well, patients come into my office with ear congestion, usually at the end of the rainbow. They've exhausted other avenues. They've had chronic ear infections. They've been on multiple antibiotics, and they just continue to be reoccurrent, and they're very fearful of putting tubes in the ears. Not every kid gets these ear infections. It's not every kid, it's some kids.
Yes.
And again, some kids also may have underlying allergies and overhistamine production, which may lead to that congestion. It's whatever's in that patient's best interest in order to allow them to be free of that fluid accumulation and to improve learning and hearing. So from a proactive, or I like to say that, that I don't think everybody needs to come in to avoid ear infections.
Okay.
I think you need to come in if you're suffering ear infections or ear congestion.
Okay.
My goal is to allow the body to eventually either catch up or the drainage to occur that you don't need to come into the office. Yeah.
And how many adjustments does that take, or how many appointments does that take in order to see any type of relief? Is there a series of appointments? Is it patient by patient, visit by visit?
Everybody is different in that aspect, and some kids may have worse congestion than other kids. Your intention, you have intention to where you hope the patient will respond. If it's one visit, wonderful. If it's 6 visits, wonderful. If it's hey, it helped, and then I'm back in 2 months, I'm back again, it's again, and that adjustment helps again. So be it. So it's very patient to patient on how that works. It's not a set formula like you need 3 times a week, then 2 times a week, then 1 time a week. That's not the way I run my patient. It's how the patient responds to care, and then the continued therapy follow then after.
Excellent. Okay. Do you want to do the TMJ since I've been chatty?
How, as a chiropractor, you mentioned that you have patients that suffer from temporomandibular joint disorder. So how are you supporting that? What does that look like?
Well, a TMJ is a very common complaint, both for kids and adults. You have to come to the conclusion of why somebody has TMJ. The number one cause of TMJ dysfunction is muscular imbalance. You have 4 muscles involved in mastication and jaw motion. You have your masseter, which is a big, powerful. You have a medial and lateral pterygoid, and you have your temporalis. And they should be in perfect synergy in allowing for perfect alignment and equal joint opening. So many times this can happen traumatically. I like to call that active injuries. Somebody takes a blow to the jaw. There's maybe a whiplash injury where there's an extreme drawing of the arm, of the mouth opening, creating a dysfunction, an imbalance in the musculature where you start to get asymmetry in jaw motion, versus passive injuries, which somebody that don't realize that they're creating change. If somebody sleeps on their jaw every night, eventually the body says, hey, this is the new pattern of the muscles. Muscles here become lengthened, muscles here become shortened. Next thing you know, progressively, hey, I didn't do anything. I don't know why my jaw's bothering me. I don't know why it's opening asymmetrically. I don't know why it's starting to pop. And they don't realize that these little things they do, whether on their desks like this, so I call those passive injuries. The other, and both the active and passive injuries respond very well to care.
Okay.
The other that's more difficult to treat is somebody who has true anatomical problems, underbites, overbites, some type of anatomical dysfunction that puts more stress on those muscles, and that's more difficult to treat. As you know, it can be treated, but it's also, you're not solving that anatomical change. You're more supporting and trying to help them from a palliative perspective.
With TMJ injuries, is chiropractic able to support those patients in and of itself, or does there need to be a physical therapist or a massage therapist or someone else that's supporting, whether it be that muscle tension or muscle development in terms of building or supporting those structures or that structure?
Look, not every chiropractor deals with TMJ. You have to know what you're doing. Not every physical therapist deals with TMJ. Massage therapy, I don't know if they know too much specifically about TMJ. No disrespect.
No? Yeah.
As a chiropractor, we're in the realm of dealing with all musculoskeletal and neurological. Physical therapy is probably encompassed within that.
Okay.
We're doctors of chiropractic, and this isn't a chiropractic versus physical therapy thing, but as far as chiropractic, what we do is we find the lesion, I like to call, in the muscle, and we take that muscle, and I use a technique called ART, active release technique, where you put the muscle in a shortened state and you lengthen the muscle through passive motion and through active motion, where the patient is really opening the jaw, and you're literally grounding out that muscle and letting it heal, grounding out that muscle, letting it heal, and you're trying to create that balance. These are very tender muscles associated with the face. Yeah, not to scare patients, but the first 1 or 2 treatments, it's like, very, very uncomfortable. As you get used to care and as the body starts to heal, the therapies become way more comfortable. Other modalities involved with that are also ultrasound. Ultrasound can be used on a continuous wave to bring heat into that area to make that muscle more supple. Dealing with the chiropractor who knows what they're doing, it can be very effective in resolving, not to mention bringing awareness. If you are that person who has those passive injuries, stop sleeping like this, stop putting these positions. You don't realize you're doing these things, creating these imbalances.
100%. I know my sister-in-law came to you for TMJ, and she swears by the treatment. She had tried anything and everything that worked, but it was ultimately her time with you that made the difference. Do you find your treatment approach for TMJ varies between the pediatric population and the adult population?
Well, you do. I mean, you have to understand, children, pain threshold could be a little bit lower. You have to kind of slowly get into this. But the treatment necessarily doesn't change. They have the same muscles we have.
Okay.
And the wonderful thing about children in pediatrics is they respond so quickly. Those patterns are easier to be corrected in their short duration of life versus something you've been doing for 25 years, where it's a more chronic pattern. These chronic patterns also with TMJ can start leading to wearing out we have these little discs that live in our TMJ, and they can start getting worn out. And when we start getting worn out, now you're dealing with breakdown of a joint. It becomes, again, a little bit more on the chronic end. Kids, you nip it quick, you figure out the reason why. If it's hopefully it's not anatomical, and you can resolve it. If it is anatomical, you can give some of that supportive palliative relief as they try to tackle other ways to try to correct that structural deficit.
Got it. And I feel for the pediatric population, especially that mouth guards aren't being provided and different oral appliances, especially because of that primary dentition, having the option of chiropractic care to support their TMJ or their symptoms associated with temporomandibular joint disorder is always a benefit, especially to our patients. Mm-hmm. How about in terms of language development? Is there some way
with those night guards?
Go ahead. No, you go. Go ahead. Tell me about those night guards.
Saying, you think about the other approaches in dealing with TMJ. Yeah. You go to a dentist. Here's a night guard. The night guard doesn't necessarily resolve a lesion, a shortening, a lengthening of a muscle. What it does is typically people with TMJ tend to grind their teeth, because they're in this state, and so the night guards don't necessarily create a tracking or an improvement of the lesion. Okay. Now, can it protect your teeth? Absolutely. But in my book, it doesn't necessarily solve the issue of what's causing the TMJ dysfunction. Again, the number one cause of TMJ dysfunction is muscular imbalance. A night guard isn't going to change that.
Yes.
Now, there are more invasive ways. Some dentists actually inject into those muscles. Again, a little more invasive. Now certain patients that is necessary. You may have to go more invasive, but when in the spectrum of, again, of nothing to the most invasive, you want to try to exhaust everything possible to try to get to that resolution.
Absolutely. And, myofunctional therapy is the same focus, is dealing with that muscle imbalance. So it's amazing how much we cross over into each other's fields in terms of how TMJ impacts not only the myofunctional therapist, but also the treatment via chiropractor.
Absolutely.
So back to, in terms of language development, do you see any importance or anything as a chiropractor that can support overall growth and development when it comes to language development?
Well, language, I mean, obviously you're more focused on that. I mean, my stuff may secondarily be affected with learning. So we talked about the ears with the fluid. Well, if you're on the water, you're not listening, your pronunciation's off, and your hearing is reduced. Coupled with, say attention deficit disorders, so, when somebody can't focus and can't learn, again, that may be involved with learning and or hearing and or pronunciation. From a chiropractic perspective, the way that we can help with attention deficit disorders is, your nerves control every cell, tissue, and organ in the body. With adjustments, especially to the thoracolumbar region, you create a balance in the autonomics. Your autonomic nervous system has two parts, and it's in a perfect harmonious seesaw. You have your sympathetic, which if you remember from school, that was the fight or flight.
Yeah, you're bringing all this back to us now, right? Yeah.
You feel like I'm in grad school again. You get into an almost car accident, or you're almost fight. That adrenaline rush. It's the fight or flight. All your blood shunts to your area to protect yourself, to flee or protect yourself, and it suppresses the parasympathetic, which controls all your visceral organs. So when somebody is in a heightened state of if you have issues in your spine, it raises the sympathetic output. It suppresses parasympathetic. Not to mention, it can also affect mast cell production, causes an increase in histamine. So kids with asthma, kids, back to the allergies with congestion of the ears. But that adjustment to that area balances your nervous system, and you're in a less of a sympathetic tonia. You're reducing that sympathetic output, and kids can focus a little bit better. Many patients come to me again at the end of the rainbow because their kids are prescribed medicines. The kids are, it's interfering with learning. Now there's a 9-to-1 ratio, boys to girls with attention deficit disorder. Well, the testosterone is a portion of that. When my kids used to have play dates, my daughter, they would share the crayons, and my son, he'd break the crayons and throw them. So there's a little difference there. So, but chiropractic care again can help in balancing of the nervous system and allow these kids to be better in tune with their environment and helping them with their learning processes. In regards to development in language, this is all involved with that. If we can get them to be able to focus a little bit better, if we get them to hear a little bit better, then their learning is improved.
And in terms with ADHD in particular, attention deficit disorder, what does a course of treatment look like? Obviously, that's something that's, part of their neurology or however you would say it's part of who they are. How does the treatment for that work? Is it something long-term, or is it something that's short-term with long-term effects, or is it something they have indefinitely but maintained long-term with regards to chiropractic care?
Everybody is different. I like to go through a course of care, and I like to see how they respond. My whole idea is if you're having upswings, to come in. If the adjustments are effective and they're holding, and a person is their nervous system is better flowing, they're better intact with their environment, and they're improved. If there are maybe an upswing where there's more of an imbalance of the nervous system, the adjustments are helpful in restoring that. We find maybe when they're a little bit younger, and then kids tend to outgrow these things, or they're better involved to understand them from themselves, to be able to focus, to have more control. But it's person to person. It really is. Personally, I don't want you in my office 3 times a week for the rest of your life. I want you to get the care that you need to hopefully be able to, and for those kids to be able to learn better and be more content.
It's not cookie cutter. It's patient specific based on.
It's so individual.
Absolutely.
Absolutely.
How about sleep apnea, sleep disturbances in children? Can a chiropractor help with these types of patients in children?
Well, sleep apnea it isn't so much associated with me. When you talk about sleep apnea with children versus adults, that sleep apnea that tends to come later on in life, there are certain typical body type, tends to be more of an obese, sedentary type of person, and they develop that sleep apnea, which can cause long-term effects. It's more stress on the heart. Sleep apnea is the equivalency when you're sleeping, you're holding your breath, you're not breathing. It's like doing a 50-yard dash throughout the whole night. You really don't get into deep sleep. Your cortisol levels increase, your stress hormones increase, puts more stress on your heart over time. It can lead to high blood pressure. You're gaining weight, can lead to diabetes. It's a whole callus of events. Getting the proper diagnosis of sleep apnea can truly save lives and health ailments. So starting on a youth end, it's typically, when you see that sleep apnea from children, it's usually because these kids, their adenoids and tonsils are at the age of, I believe the age of 4 is the size of an adult, of which the rest of their body is not. And so that catch up, creates that problem where, leading to sometimes, eliminating and taking out the tonsils and adenoids, which is invasive. Those are lymphoid tissues.
Yeah.
They produce white blood cells. So if you can be avoided, wonderful. But with children, it's interesting. It's like a catch up, but if it becomes so invasive that it's leading to these other health effects, and if they're not sleeping, now we're going back to learning. Now we're going back into ADHD. Now we're going back into this whole other realm. So proper diagnosis. Now, do I treat that so much? Not so much, but I'm acutely aware of it. Absolutely.
Okay. And is there anything that you are doing that can help to open the airway more, that maybe could support an individual that has these enlarged tonsils and adenoids, and a parent is yet hesitant about going under surgery to whether have them removed or shaved or what have you?
Tonsils and adenoids in regards to airway, no. In regards to respiratory improvement, asthma is something that we help.
Okay.
As a chiropractor, I like to say I collaboratively help in ailments in treatment. I do not put my eggs in my basket to say, hey, you got asthma, just come here, don't do anything else.
Right.
You have to be managed. This is what's wonderful in healthcare, as we all have a little piece of the puzzle to help in what's in that patient's best interest. Adjustments. I kind of briefly skimmed over in regards to the thoracic spine in regards to asthma, where there's an increased sympathetic tonia, as we talked about that seesaw. You can have an increase because of the increased sympathetic tonia. You have a release of mast cells that produce histamine, and that increased histamine can lead to asthma. And so, many kids grow out of asthma. Well, how does that happen? So the adjustments to the spine do help in reducing the asthma and helping them being more in contact with as their nervous system can flow, and hopefully grow out of that. But in regards to opening up the airway from a chiropractic perspective, anatomically, we can't change the size of those tonsils.
Right.
We hope they grow, that it is proportionally more symmetrical. But not any physical change to the size of the adenoids or tonsils or airway.
Mm-hmm.
We try with adults to get them back into a more healthier lifestyle. That maybe, again, on the adult spectrum, let's engage in more healthier lifestyles. Let's try some weight loss situations, better diet. In chiropractic, we're doctors that discuss that kind of stuff with our patients. So it's yes, the wellness on care and feeling better and dealing with ailments, but it's also the lifestyle changes that promote wellness.
Mm-hmm. And I feel like your facilities are very interdisciplinary in nature, which is an absolute benefit to your patients. And that's absolutely a benefit to us as speech language pathologists. Again, we can't work in a vacuum. We can't work by ourselves. We definitely need these other professionals to be working as that interdisciplinary team to get those long-term results. And that's one of the things that's been so wonderful about you and your facility. Thank you so much for being with us today. I think you've provided a wealth of knowledge, not just for our patients, to us, but hopefully we're able to take this information and educate many more people, and open their eyes to how much more chiropractic care can do, especially when they are maybe averse to long-term medication or a more significant or invasive approach such as surgery. I think that is what we've accomplished today, and I appreciate that very much. Thank you.
Thank you. I appreciate the opportunity to be here. And as we're all involved in the wellness and helping the children, it's just an absolute pleasure to be here today. And I appreciate the invite. Thank you very much.
You're welcome. Have a great day, Dr. Campo, and we'll speak soon.
Thank you, Dr.
Take care.
Campo.
Bye-bye.
Take care. Bye.